Any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here in BFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Your health matters.
How much do you know about what makes up a healthy lifestyle?
Your health matters.
How do you define good nutrition?
Join Dr. Gerald Thompson, physician, specialist, and notable environmental conservationist, every Wednesday, 8 to 9 p.m. here on BFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here in BFM 99.9 because your health matters.
And a very pleasant good evening to you. This is Dr. Gerald Thompson with Your Health Matters. And it does. You know, as we approach the end of the year, you know, I'm always, I'm a Christmassy type person. And, you know, we'll be sending out those sort of greetings later. But remember, this program is interactive. 457-9997. And the same in terms of WhatsApp call as a general call. WhatsApp 457-9997. Or you can call Digicel 532-997. There's always a 9997 concept here. Now, last week, Kamal, we were talking about genetics. Imagine that. I suppose some of you listeners will say, oh boy, that topic is big. I was trying to simplify it. And I started talking to you about a few things. I told you that in your body, in every single cell of your body, there are 23 pairs of chromosomes in those cells, in a section of the cells called the nucleus. And if there are 23 pairs of chromosomes, that means there are 46 chromosomes. Well, there should be 46 chromosomes, right? And each chromosome deals with a number of different things. Basically, each chromosome has on them genes. I'm not talking about genes that you wear. I'm talking about your genetic genes. And there are two special chromosomes in which they don't really have a pair as such. They are the sex hormones. And the females have two X's and males have an X and a Y. And we went into a little detail about males who had a little extra, X chromosome, yeah? And they call Klinefelter's syndrome. Well, I want to finish this off, but I want to move on to a slightly different topic because we started touching on something called sickle cell disease. I was telling you about it. I don't want to really touch on that. But I was telling you that in your chromosomes, these 46 chromosomes, there are genes. Actually, on these chromosomes, there are about 20,000 genes. But That's not all. There are more genes. There's some genes that are inactive. Do you know there are more genes that are inactive than genes that are active? And what do these genes do? These genes, as I say, are not genes that you wear. These genes, they're not Levi's or Jordan or whatever the case may be. These genes are your genetic programming that help make protein. Your muscle is made of protein. Your skin is made out of a lot of protein. Your eyes, your tongue, your brain. Yes, there's some starches inside there, and yes, there's some fat inside there, and yes, there's some minerals and all that kind of thing. But protein, all kind of different type of proteins, And these proteins are made like a jigsaw puzzle to go in specific places. You can't go and fit in protein that shouldn't be where it's supposed to be. So kidney proteins, lung proteins, eye proteins, and these genes also determine how you look and how you function, the color of your hair. If you have red hair, if you have black hair, if you have brown eyes, green eyes, red eyes, blue eyes, if your nose is big, if your nose is pointed, or if you're tall, if you're short, and all that sort of things. And these characteristics are on different types of chromosomes programmed by different genes. That's how you are genetically made up. And your parents will pass on some of those genes to you. Your mother will pass on some genes. Your father will pass on some genes. Some of it will come from your grandfather. Some of it will come from your grandmother on both sides. And that's why you look a little bit like your father or like your mother. And that's the core of genetics. And I was saying that there are these special chromosomes, the X chromosomes and the Y chromosomes, and these are the sex hormones. Now, this is important. You have to have an X chromosome to survive. Life depends on the X chromosome. You know, you don't have to have a Y chromosome because you can have two X's. But you have two X's. It doesn't mean you're going to live longer than the person who only has one and a Y. That ain't like that. Those hormones determine sexual function, but they're also essential for life. Now, I was telling you about these hormones. Well, let me go on to say a few other things about these sex hormones before I get on to sickle cell. Because do you know that, interestingly, that you can have an extra Y chromosome too? You have 46 chromosomes, you can have 47, an extra Y chromosome. And XYY is still a male. You understand? XYY is still a male. XXY is a male. XYY is also a male. Let me put it this way. I talked last week about Klinefelter syndrome. 1 in every 650 persons have males have an extra X chromosome. Well, there are males who could have an extra Y chromosome. Remember, an X and a Y make you a male. But having an extra Y, you're still a male, but you typically have some speech and some learning problems. You will have some social challenges at a young age, and that can affect your self-esteem. In other words, you still look good. You're not going. There's no deformity or anything like that. And sometimes people don't know until they have a genetic test. So it isn't that somebody looks as if they have XYY, an extra Y chromosome. It's only if that really has a genetic test. So 47 chromosomes instead of 46. And I could go on. But I want to talk additionally that you can also have not 47, but 48. You can be XXYY. XXYY. Again, these are males. So humans with XXYY, now the extra X and an extra Y are definitely looking like males. They have 48 chromosomes instead of 46. And this affects 1 in every 30,000 males. So in a place like St. Vincent, we have 105,000, there will be at least 3 persons who may have had XXYY. Now, what about girls? There is a syndrome called Turner syndrome. And this is a female who definitely female gender, and it is quite common. I'll tell you what it is. It occurs 1 in every 2,000 girls born. So here in St. Vincent, if we have 100,000, if there were 2,000, boy, you know what that means? That means that there should be at least 50 persons with Turner syndrome here in St. Vincent and the Grenadines, right? It's actually quite common. And what does Turner do? Well, this is interesting, right? A Turner syndrome has 1 normal X chromosome rather than the usual 2. The other X chromosome is not functional. Do you hear that come out? The females have 2 X chromosomes. We know that 2 X chromosomes. But if one of them is not functional due to some variation that can take place, even when the baby is conceived in the womb, that one of the X chromosomes is not functional. This is 1 in every 2,000 female babies. I mean, that's amazing. And what if did you know all these genetic problems develop? And it's important that to know that some persons with Turner syndrome, they tend to suffer from depression. They have irritable bowel syndrome. They have migraines. They have thinning out of their bones, called osteoporosis. They have a higher incidence of stroke, thyroid disease. They also have a lot of incidents of anxiety, autoimmune diseases, that the immune system is all overactive. They have a higher incidence of breast cancer. Now, breast cancer in men is certainly 100 times more common in women, but occurs in men. But the average risk of a woman developing breast cancer in a lifetime is about 12% now. But you can reduce, your risk to live a healthy lifestyle. But Turner syndrome is something that we definitely see. It's quite common, and I've seen a few patients, not here in St. Vincent, but statistically it should be quite common. And I wouldn't describe the Turner syndrome female. Usually they're quite short. I don't want to go into details, because this could lead to some discrimination, but it is actually quite common. Now, you only need one X chromosome to survive. You must have an X chromosome to survive. So if one of them ain't functioning properly, you still survive. In the case of a female, it will lead to a Turner syndrome on occasions, Kamal. You understand? Now I could go on and on and on, talking about this, the sex chromosomes and so. But I want to switch again to sickle cell disease, because this is another genetic disorder that is actually quite common among Black people. Remember what I said? We would have inherited it from our foreparents coming out of Africa. And this was a genetic evolution trying to protect your body against malaria. Malaria is a parasite, and it gets into your blood from a mosquito putting its proboscis, its straw-like nose through your skin, just like with dengue, just like with chikungunya and so forth. And it injects the malaria parasite into your blood. And this malaria parasite does a whole set of things, but guess what? It gets into the red blood cells and starts to multiply. And when it starts to multiply, it causes the red blood cells to just burst. Just burst. The red blood cell can't handle it. Can't handle something growing inside it. It just bursts. And you can have a malaria. Gosh, let me tell you, your temperature goes up. Your temperature goes up to about 105. Malaria gives you one of these high temperatures. And we got to zap you down with cold rags to keep your temperature down. Because if your brain gets heated too much, your brain starts to fry. You know what I mean? So you don't want that. Little babies, you don't want their temperature to get too high. Their brain will fry. So you got to keep temperature down. But malaria is one of those things, boy, the temperature just goes through the roof. And you have to be so careful. Now, what happened over a period of time, there became an evolution where some genes started expressing themselves and causing the red blood cells not to develop properly, so that the malaria say, I'm bothering to infect this person. I'm not going to survive in this person. So therefore, sickle cell patients emerged not becoming infected with malaria. And they survived for periods of time. At least they survived until they could have children or could pass on the genes of sickle cell to their kids, until thousands, millions of them developed. Now, what are we talking about? What is sickle cell? So sickle cell disease is a group of inherited red blood cell disorders. Remember, in your blood, you have different things. You have red blood, you have white blood cells, and you have these other sticky stuff called platelets to help your blood clot. If you start to bleed, you won't bleed out, you need platelets. And your red blood cells are the ones that carry oxygen, and they're nice and round on one side, but kind of flattish on another side. Everybody remembers that from biology and so forth. You remember red blood cells. And your red blood cells contains hemoglobin. Oh boy, this is so important. This is the essential stuff for life because it carries oxygen. Hemoglobin combines with oxygen, and in your lungs, when I breathe, my lungs, the blood passing through my lungs picks up the oxygen from breathing in from the air, and then those red blood cells that contain the hemoglobin that now have oxygen attached carries the oxygen to all parts of my body, my brain, my liver, my kidneys, my toes, my fingers. My body needs oxygen, you know? We need oxygen. Can't do without it. So guess what? Red blood cells contain hemoglobin. And the hemoglobin is a protein that carries oxygen. But healthy red blood cells are round, as I said, a little flattened on one side. And they move through the blood vessels to carry the oxygen to all parts of your body. Now, in someone who has sickle cell disease, the hemoglobin, the structure of the hemoglobin, the protein made by the genes, right, is abnormal, Kamal. You understand? And it causes sometimes the red blood cell to develop a funny shape, a shape called a sickle shape. In other words, I'm going to hold this up. Normally, the red blood cell is nice and round. I should have had a nicer example. The red blood cell is nice and round, just like my headphones, nice and round, you know? And believe it or not, the red blood cells has sometimes a little dimple on one side. It's a little flattened. And because it contains hemoglobin, the hemoglobin is red, so red blood cells are red. We know this. And when there's oxygen attached, and guess what? Your red blood is redder. You understand? It's red. Now, if the protein that the cell is made is abnormal, it can become wrinkled like this. It's no longer round, it become wrinkled. And that ain't good. When it's nice and round, as the red blood cells bounce up on each other, they bounce off of each other, you know? But when it's like this, and guess what? Another red blood cell sticks to it and, gets caught up. And they start to clump together. They clump together, and that's what we call sickling. Now, unfortunately, this sickling is where instead of the red blood cells being round, they become almost like a C shape or a stick-like shape. And they start getting all kind of little spouts like this. I hope I've described it for you, right? And so these sickle cells stick to each other. They clump together. They don't bounce off of each other. They clump together. And they start to die early too. They can't survive. So someone who has sickle cell disease, I want you to understand that their blood is abnormal. The sickle cell cannot carry as much oxygen as it should. The sickle cell is, I've said it 3-4 times, is going to clump and start to clot together. So you imagine these sickle cells passing through a very small blood vessel. And instead of passing through nice and smooth, instead, they stick, they're stuck, and all the other blood's coming up and building up on it. It's like a heap of red blood cells, but instead of nice, round blood cells bouncing off each other, they come like a heap, sticking to each other, and they could clot inside that blood vessel. Now, if they block a blood vessel, blood nutrients ain't getting through, oxygen ain't getting through. And when oxygen can't reach tissue, one of the first thing the tissue starts to do, the tissue starts to become painful. So you could imagine sickle cell patients, if they start to sickle, their body starts to feel pain. And I have seen sickle cell patients in what I call a painful crisis. Boy, you know what you got to do? We got to give them fluids, give them lots of fluid, we got to put up a drip. We got to put up a drip of life water, and flush them so that hopefully it will cause those sickle cells to separate from each other. We got to give them oxygen, put them on oxygen quick, put on a mask and turn up the oxygen. And you have to give them pain medication because they're crying, they're bawling, and that raises all kind of other stress. Could you imagine if a blood vessel going to the brain gets blocked with these sickle cells? Person can develop a stroke. Suppose their heart, a blood vessel, the coronary blood vessel and sickle cells start to clump inside the heart. That person give a heart attack. Suppose it happens in their kidneys. Suppose it happens in a finger and no blood is getting down to the pinky finger or the thumb. The thumb or the pinky could even start going black and dark because it isn't getting any blood. So this is what sickle cell is all about. The protein from this abnormal gene called sickle cell, the sickle cell gene, is causing the structure of the red blood cells not to be nice and round. It's causing it to become stringy, C-shape, a sickle shape as we call it. And that causes problems. Now, there are a number of little different types of sickle cell. I'm not going to go into them, But I want you to remember that if your mother has the gene for sickle cell and your father has a gene for sickle cell, and they're both sickle cell, we call trait, they only have one gene. When they have babies, the father might pass on his gene to one of his children, but the mother doesn't necessarily have to pass on her sickle gene. So therefore, the child that is born has one gene, but doesn't have two. But they could have another child, and the gene from the mother and the gene from the father, each of them could pass on that gene to that second baby. And that baby is now born with two sickle genes. When that happens, usually by about the first 6 months, that's when sickling starts. Could you imagine a baby at 6 months crying and you're wondering, is it the baby is hungry? Is it the baby has a cold? No, it's sickle cell. Normally these days we would know. What triggers sickling? One of the biggest thing that triggers sickling? An infection. Imagine catching a cold. Imagine catching COVID. Imagine catching a... Now, long ago, before there was antibiotics, before there was any kind of treatment and so forth for infections, patients with sickle cell died young. An infection would come up, they get a cut or something, so the infection triggers the sickle cell and they would die. When antibiotics came on in the 1940s, 1950s, a lot of black people now were being treated, and they could survive a little longer. Half of all patients with sickle cell can live beyond the age of 50, but a lot of them tend to die before that from one type of problem. Yet we'll get into those things. And so the question, can a sickle cell patient live long? Well, people with sickle cell can live very active and full lives, but we've found that they typically, many of them pass before the age of 50 because of a stroke, because of a heart attack, because of some problem they've had. Now, can women with a sickle cell disease have a healthy pregnancy? This is a woman who has the two genes. She's having sickle cell. Can she have a healthy pregnancy? Can she have a baby? Yes, she can. And she needs to be managed properly and so forth, so that it doesn't cause much problem. As I said, there are things that trigger it. People, I don't know the reason why, but they say that ham and bacon and those other things tend to trigger it. If you don't drink enough water, if you live in a place where there isn't a lot of water and you ain't drinking water, that means your blood becomes a little thicker. Now we'll take a break, we'll come back, and we'll dig a little bit more into sickle cell disease.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes, remember 4579997, WhatsApp, straight call. Give us a call, hear your views and so forth. Tell us if you might have sickle cell, or you know somebody, or whatever the case might be. If you've had any experience with them, or you yourself have had any experience, with this. We have a call here. Hello, good evening.
Dr. Thompson.
Yes.
Good evening to you, sir. I've not spoken to you for quite a while.
I know. How are you? How is Barbados?
Yeah, I hear you're having some rain, and I'm loving it.
Okay, good.
But apart from that, I'm good. I'm good.
Yes.
Now, I want to ask you this thing.
Yeah.
Can you have sickle cell by itself? Because apparently, listening to you, I get the impression that sickle cell is one thing and blood clots is another, but a blood clot could join up with sickle cell. Is that correct?
You can have sickle cell anemia. That's the disease itself. But when you get complications and problems, when you go into what's called a sickling phase or an episode, blood clots can develop. Now, when I remember blood clots, I want you to understand what my blood clot means. A clot is developing a blood vessel because the red blood is accumulating there and it's not bouncing off each other. It's not they don't have smooth surfaces, so they're clumping. It's like rugby. You understand?
Yeah.
It's a scrum and a rugby, and they're all on top of each other. Huh?
Yeah, scrum.
It's a scrum. It's a scrum they have.
Yeah.
And some people think a blood clot means that the blood clot is traveling. You understand? And moving along. But the blood clot can develop right there at a particular point and stay there. And therefore, it is blocked. It's like a road. Suppose there's a pile up on a highway or pile up on a road, and no cars can now pass. I mean, they may be able to get around in another way, but blood can't pass. So therefore, there's no traffic beyond that pileup, that means the tissue beyond that pileup isn't getting the nutrients and the oxygen and so on. It starts to die. And the first sensation of dying is pain. Pain. When tissue ain't getting oxygen and nutrients, they start to experience pain. And sickle cell.
Doc,
go ahead.
I could tell you about the pain. I had 2 blood clots.
Yeah.
One in my left lung and the other in my right lung.
Oh, you had a
One
pulmonary
2 years
embolus.
after the next.
Yes.
Pardon?
You had what's called a pulmonary embolus, right?
Right. One in the left lung and 2 years after the other one in the right lung.
Wow. That's not
And I
bad.
can tell you that 3 o'clock in the morning, I wake up my wife and I tell her I am feeling some excruciating pain on my left side and I don't like it. Take me to the doctor. We went to the doctor. The doctor they say that I have a blood clot and they sent me straight to the hospital.
Yeah.
When I went to the hospital, I was admitted. But I was feeling some pain, some excruciating pain.
Yeah.
And the doctor told me I was lucky.
You were lucky. You were lucky to
Yeah.
have the pain. You were lucky
Right.
to have the pain. That alerted you,
To tell me what's what.
tell you what something is wrong, and you got to
Yeah.
the emergency room or you got to the doctor quick.
Yes. Correct. And then they put me on some warfarin.
Yes. Some blood
And then-
thinners. Yes.
Yeah, warfarin blood thinners. And then my blood came to normal.
Yeah.
The clot was gone after some more tests.
Yeah.
And then the 2 years after, about a year after,
You had
I
it
a
again?
second blood clot.
Oh my gosh.
Yeah. On the other side.
Yes.
And I had to go back to the hospital.
Yeah.
But apparently, the second was not as bad as the first.
Yes. Yes.
But I just want to say this, Doc.
Yeah.
A blood clot is a serious, serious thing. And people should not take blood clots for
Yes.
granted.
Yes.
And what I would like also to say, Doc, is that you should explain to the people
Yeah. Okay.
what the symptoms, because the symptoms,
I'm
things
doing
like
that. Yes.
sweating profusely
Yes.
and pain, like
Yeah.
you just said.
Yeah.
And one or two other things that I am sure you can describe to
Yeah.
the people.
Yeah.
But one of the things that I always say about blood clot, Doc,
Yeah.
a perfect blood count, the INR, is between 2 and 3.
Okay.
And if it is at 2.5, that's perfect.
Yes. Yes.
Because if it goes below 2, there's a possibility of another blood clot where the blood is becoming thicker.
Hmm.
And if it goes above 3, it can mean the blood is so thin that it can have internal bleeding and die too.
Yeah.
Am I correct?
You're absolutely right. And there are we now say patients under 65 who are at higher risk should probably be on some what we call a baby aspirin, right?
Yeah.
If you've had the clot, we want to get your blood thin. But before that, some individuals, we may recommend that they go on a tiny baby aspirin, just 81 milligrams. And that helps
But
yeah.
But now, even with the warfarin, I was told by the doctor that you can still take a baby aspirin although you're taking warfarin. And I
Yes.
know I had promised to get a second opinion on that.
Yeah.
Because I figured if you're taking warfarin, then there's no need for baby aspirin. Your thoughts, Doc? Your professional opinion.
Yes, no, I tell you something. There's nothing wrong, but some persons who take the aspirin, they can have a complication where the stomach starts to bleed a little bit. And as they're on, the aspirin can irritate the stomach, scrape up the stomach a little bit. And if they're on the warfarin, then they might start to bleed slowly. So they're dripping blood out of their stomach all the time. And they then find that they're a little anemic. Or guess what? It can start to bleed rapidly and they can't stop it because their blood is thin. So it depends. It depends on the circumstance. But if you're at high risk for heart attack and clot, boy, I tell you something. the chances of bleeding is far lower than the chances of clotting again. So I think staying on the side of keeping the blood thin is a good thing,
Right.
rather than being
Right.
worried that the blood may be a bit too thin. You know?
Yeah. It's better to err on the side of having a little bit thinner
Yes,
than have a little bit thicker.
that's right.
But now, let me say this to you, right?
Yeah.
I feel the governments of the Caribbean, and I'm speaking now specifically about Barbados,
Yeah.
but generally the governments of the Caribbean should allow people to bring in certain medical instruments that can help them. And let me explain to you what I mean. There's a portable INR machine
Yeah.
that you can use that at home to tell your blood count.
Okay. Yeah.
In Barbados, you can't find them things. And I feel the government should import a lot of them so that people could test the blood periodically to see what is the INR count. And if it's getting too low, then you should be able to, well, if it's getting too low, when I say too low, it's getting too thick, then you should be able to at least use
Yes.
0.5 milligram more of medication.
Mm-hmm. Well,
To bring
you
it
know,
back to where it should be.
you know something.
And if it's too thin,
Yeah.
they could cut back on at least 0.5 milligram
Good.
of medication
Yes.
to bring about to where it should be.
Yeah.
And that way you will save yourself from going to the hospital or dying or whatever.
Mhm.
Your thoughts again, though?
Well, you know, if you are astute and you do have the funds to do that, then there should be nothing wrong with doing it. The big issue is sometimes doing these tests, some people come with the wrong results and can be fooled and tricked into thinking that it is normal when they do need to make an adjustment, you know? So sometimes getting the blood test from the lab, you're more assured of getting an accurate result than doing it yourself. But if you are comfortable, if you're a person who's worked in these sort of things before, you feel comfortable and you really want to stay on top of it, nothing wrong with that at all. You know what I mean?
Yeah.
Okay.
And in closing, let me say this to you. I go every 6 months to get my INR done
Yeah.
to see what's my blood count.
Okay.
And
Good.
it's normally between 2.3, 2.4. And for me, that's perfect. In fact, the doctors told me that that's
Yeah.
good. But-
People may not understand what the INR mean, but what they're talking about is how thin your blood is to help prevent those red blood cells, the platelets from sticking to each other and causing a clot. You understand?
Right.
So
correct.
what the caller is talking about is, to what extent is the blood just a little bit thin enough so that it won't clot, but it is not too thin to then start bleeding. You know what I mean? That's the important
Doc,
thing. Yeah.
The doctors at the hospital had prescribed 4.5 milligrams of warfarin for me nightly.
Yes.
And I take that every night at 8 o'clock. But you
Okay.
know what? I have added to that.
You've added to that.
I use 4 and 3/4
Yeah.
milligrams of warfarin.
Yes.
And the doctors don't know I do that, but I do that, and for years now.
They listening, you know. They're listening to you. They don't know. They don't know you.
All of the doctors in Vincent know that.
I know that. Yes.
But no, that's what I do, and I find that unknown to the doctors, I do that, and my blood count is usually very good, very good.
Beautiful.
So,
Okay.
so shall I continue with that, Doc?
Yes, you do. But here's something. You know best. You know best. I may not necessarily give you the recommendation to do it because of medical legal issues, but if you, I trust that you know best. You know your body. You know yourself, and you've been doing this for a while. And if it works for you, then more power to you.
But Doc, the thing about it is that I used to use the 4.5,
yes.
4.5.
Yes.
And my blood count always used to be my blood count used to be hovering around 2.1, 2.2.
Yes.
And I increased it myself to extra 4 and 3/4 milligrams
Yes.
of the warfarin, and
Yes.
it came out a little bit, and
Mhm.
now it is around
Beautiful.
4.5,
Beautiful.
4.4, 4.5, 4.6,
Yes.
and it's in that vicinity all the time for a couple of years now.
Yes.
And I seem quite happy. I would not want to tell the doctor about that because he might tell me, but I ain't give you that. I prescribe that for you.
Yes.
But he ain't gonna prescribe it for me. I prescribe it for myself.
Thank you very much for
And it is not-
calling. Thank you very much.
Yeah, man. So
All
you
the
stay
best.
safe.
Yes,
And
thank
I
you.
want to say good night to my girl Anita and
Yes,
Kingsley.
you bet. You bet. Yeah, all right.
All right, now.
All the best.
Get it.
Now, that caller there, he was talking about a general blood clot, mainly caused by the problem with those sticky platelets. But with sickle cell, what's happening is the red blood cell itself, the structure, the protein makeup of the red blood cells is abnormal. And when certain conditions develop, like somebody's dehydrated, or it is an infection, or there's low oxygen in the blood, the cells start to sickle and clump. The red blood cells are the ones that are clumping and pile up like a rugby scrum. You understand? And they can block off a blood vessel, block it in the lungs, block it in the toes, block it in all kind of thing. But here what? There are many different things that could happen to the sickle cell. I'm going to go through them. Many patients, we pick them up as really having sickle cell because of pain, but guess what? They can have a yellowing of their eyes and their skin. They start having a little jaundice. In other words, the white of the eye isn't white, it's yellow. And then they are usually extremely tired. And this is mainly because of the anemia. Their hemoglobin is low. They're anemic. And they tend to have painful swelling of their ankles, their feet. Now, let me say that statistically, boys or males are twice as likely to develop complications from their sickle cell, but they both tend to have pain in the same type of way. But boys have more complications. We try to understand that why, you know? And there are different types of ways in which sickle cell can manifest itself. As I said, you can have blockage of the blood vessel. But guess what? The bone marrow in the sickle cell patient could be under so much stress trying to pour out new red blood cells because they're being destroyed, that the bone marrow says, you know what? I give up. And the bone marrow stops producing red cells, white cells, just give up. That's a serious crisis. There's an organ in your body called the spleen. It's like a filter. You know, on a car, you have your air filter and your oil filter. Well, your spleen is like a filter. Well, the spleen could start to become a bad filter. It could get blocked up and all the blood start. I've had sickle cell patients in which the spleen is normally about as big as my fist in a normal person. Could you imagine a spleen that's as big as my head in your body? A spleen that's as big as my head, and we could feel it. Oh boy, because blood is being pooled inside that spleen, and the spleen is stretched. And guess what? The spleen can rupture. That's not nice. And then, worst of all, oh gosh, the red blood cells could start to break up inside the blood vessels. We call this a hemolytic crisis. They just start to split up. Nice round blood cells, they're sickled, but they start to break up into pieces. You don't want that. There's a whole set of problems that can develop. And the way in which we treat sickle cell crisis of any form, we give them fluids, put up a drip, give them some life water into their intravenous, you know what I mean? And we sometimes squeeze water into their blood. You know what I mean? It may not be flowing fast enough, we may want to squeeze it inside there. We'll pump it in to expand their blood. And hopefully, you know, like you have a cup and there's some sugar inside there and it's a little too sweet, and you add water to it to dilute it a little bit. You want to dilute the blood so it will separate out some of those cells that are clumping with each other. That's the way it's done. And guess what? Giving oxygen, painkillers. We tend to want to use Tylenol, Panadol, and ibuprofen. Now, here from that last discussion. In the case of sickle cell, if there's a child who has sickle cell and is under the age of 16, don't give no aspirin. We don't give children under the age of 16 aspirin. Not good. Can lead to all kind of problems. Well, I'll discuss that sometime later, but we don't do it. So there are some real problems with sickle cell, and the way in which modern treatments for sickle cell, guess what we're doing? A bone marrow transplant. A bone marrow transplant. We're finding someone who matches them genetically. In other words, we check their blood. They got to have the right type of blood. If they're O blood, you can't give them A blood. If they're B blood, they can't give them this and so. And then we got to look at some other genetics. And we take some bone marrow from somebody, a brother, sister, or so, and we're able to transplant the bone marrow into the sickle cell patient. Sickle cell patients are now living a lot longer. They're having babies. And long ago, they used to die. I remember I had a young female patient when I was in England. Pretty girl. Oh gosh, a real pretty girl. She died. You know? Painful crisis. I remember seeing her laughing and so forth, and then she had a relapse of a sickle cell. And we treated her, oxygen and so forth. But the next day, come in, going to see her, see the bed empty. She had died, you know? And sadly, that's what happens. But today we have much better understanding of sickle cell. We're able to manage things a little better. We're able to give certain vitamins. We're able to make sure that the hemoglobin is managed properly, that the anemia is not so bad. Sometimes we do transplant, blood transplant. So transfusion, blood transfusion. And then we might do bone marrow transplantation if we really want to see give a good child. And that works, you know? But the best thing is when you're looking to have a child, you check, are you sickle cell trait? Do you have any genes for sickle cell? And the person you're looking to have the child with, do they have the genes for sickle cell? Because there's a chance that both of you coming together can produce a child that has the two genes. You could produce a child that only has one gene, and therefore they're what we call sickle cell trait. They have some trace of the sickle cell. They have traces of the sickle cell. There's a misuse with that too. But if you have a child and they've inherited genes, genetic genes from the father and genetic genes from the mother, and the person now has double sickle cell genes. We're talking about the sex chromosome of people with YY, XYY, and extra chromosome. This ain't about no extra chromosome. This is actually getting a gene from the mother, a gene from the father. And by 6 months of age, sickle cell starts to show. And there's crisis anytime that child has a cold, a flu, a little respiratory infection. That's why they have to be careful of the food they eat. You know what they found with sickle cell patients? Washing hands. Washing hands. And when we're doing COVID, we tell people wash your hands with soap and all that kind of thing. Sickle cell patients, they found out that if they wash their hands, they could significantly reduce the chances of developing the infection that could trigger their sickle cell. And the type of food they eat, if they could avoid food that's contaminated, cooked well, and all that sort of stuff, they could avoid picking up an infection that gets into their stomach and all that kind of thing and so forth, and get gastroenteritis. You don't want that. Those things are horrible. So sickle cell is something that a number of people here in St. Vincent have. It can cause blood clots, but it's not the same as the type of blood clot that the caller had. His blood clot would have been related to those platelets that are sticky, that are deal with clotting, and other factors. This is something that's very, very different. The red blood cells are clumping together, piling up on each other. And because of their shape, they're sticking to each other, clumping, and so. And I'm still remembering that young lady. And we lost her. We've lost thousands of others with sickle cell disease. But in modern medicine today, we are saving people. People are living well into their 50s and 60s and so, and doing quite well. Ladies and gentlemen, we've been touching on the subject of genetics. It's kind of a complicated subject, but I wanted to touch on sickle cell in particular. And you know who your partner is, know their genetic profile, and it may help that you could avoid having children who will live a life of having a number of medical problems. Ladies and gentlemen, I want to bid you a very pleasant good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingston.